A large study looking at the effectiveness of colonoscopies is getting some mixed reviews. Researchers found over a 10-year period the risk of colon cancer among those who were screened was lower compared to those who went without a screening, but their results were lower than a landmark study back in 2018. Now, the authors of that study went on to say a colonoscopy didn't significantly reduce the risk of dying from colon cancer. To give us a little insight on that study, we have Dr. Sana Arastu and she is in the studio with us. Thank you, first of all, so much for joining us.
Of course, thank you so much for having me to talk about this.
Yeah, so let's delve into the study. There are a lot of concerns about this. What are your concerns about the study?
My biggest concern about the study is that people are going to take what the media and what's going out there at face value and not get screened when colon cancer is really a preventable cancer in the United States, and we can save lives by doing colonoscopies.
Yeah, and what's the medical community saying? How are they reacting to the research and the data in this study?
Yeah, you know, we're trained to look at articles like this throughout our training and really assess what kind of study is this. And this study was not done in the US. It was not done in countries that have a screening system implemented like the United States does. And so I think the biggest fear that's out there is that we're worried people are going to take this and say, oh, I don't need to go through a colonoscopy. And really, it could save lives by taking out polyps and identifying early stage colon cancer.
Okay, and you said you actually just came from doing a few screenings
Yes,
today.
yes.
So what are your recommendations? What should people know who should be looking into getting a colonoscopy?
Yeah, so you know, the U.S. Task Force actually recently reduced the age for screening colonoscopies to 45 because the incidence of colon cancer is increasing in the United States. And we have been able to reduce the incidence in the screened population over the years that we have been screening. So talking to your primary care physician or your local gastroenterologist to talk about, is it time for you to get screened? Are you part of the regular screening population, or are you high risk to get colorectal cancer, and should you be screened even earlier?
And are there some signs and symptoms that perhaps people should look at?
Absolutely. You know, people live in their bodies their whole lives. They know what they're feeling every day. So if something doesn't feel right, especially if you're losing weight unintentionally, passing blood, black, loose stool, and a change in your stools. You know, we go to the bathroom every day, but nobody talks about it. And so really addressing it, looking at your stool and knowing if it's different, talk to someone.
Okay, that's so important. And then lastly, what are some just trusted resources that people can look to when it comes to this? Because like you said, the study was not done here. So people need to look for those trusted resources in order to really protect their health.
Absolutely. So talk to your primary care, again, your gastroenterologist, and then there are national societies that have made comments and national statements regarding this. The American College of Gastroenterology, the American Society of Gastrointestinal Endoscopy, to name a few, are out there, and they have lots of resources for the U.S. population to help guide them through this study and really understand how to apply it to their lives.
Okay, thank you so much.
Of course, thanks for having me.
Yes, and of course, all of those resources, some of those resources are on our website right now at kxan.com.